There you go, over to you, Chair.
Thank you. Morning, colleagues. Welcome to the Rotherham Place Board. And if we crack on, I think that'd be helpful. The first item on the agenda is public and patient questions. And Wendy, I'm just confirming that we haven't received any for this meeting.
No, we haven't received any questions.
Thank you, Wendy. If we move on to item 2, which is the Rotherham Integrated Care Partnership Agreement. Chris, do you want to introduce this?
Yes, I can do. Thanks, Chair. So in terms of the partnership agreement, we've been working on this over the last few months. It's a refresh of a previous agreement we've got before. I've been working with our legal partners to do this. I think, Lydia, today we're looking for sign-off, aren't we, subject to go through appropriate governance in each individual organisation. Is that right?
That's right. I think we received this at the July confidential session. I think it's already been to some partner governing bodies, etc. So I think we're all looking for sign-off. As you say, it is a live document, so we will be refreshing this again probably at March, April time next year.
Yeah, thanks, Lydia. So the intention is, Chair, is that if assuming everyone's comfortable with it, we'll sign off this through proper governance, through this board, and then through each organisation's governance. The idea is this will take us through the interim period till March, but as we receive national guidance and legislation is agreed in Parliament, that will refresh it prior to the 1st of April and the dawn of integrated care systems. So it's sort of the next phase in the Rotherham Place agreement, with a further phase expected from the 1st of April 2022.
Thanks, Chris. I think it's a well socialised document, and we've seen it a few times, which is really good news. And it's been obviously co-developed. Anyone got any comments on the document at all? Anything that we might not have picked up as it's been going through various iterations? Yeah. Michael?
Thanks, Sharon. It is actually going through our trust board on Friday this week. So I will be recommending that we support it. But if there are any significant comments, what's the pathway to get them back? Is it back through this board?
You come back to myself or Lydia, and we'll have a discussion about how to handle any material changes. Okay,
thank you.
Just in terms of timescale, Chris, really good to know, Michael, that's going through the board.
I suppose our expectation is if we can support it here today to go through our governance to perhaps when we next meet to formally sign off.
Yeah.
And then recognise we'll have this discussion in March as the situation evolves nationally.
Yeah,
that would be perfect.
Yeah, thanks, colleagues. So if we can make sure we take that back through our governance arrangements, and we'll feed back at the next meeting. As Chris said, if there is anything that anyone wants to feed back from their individual governance boards, we can feed them through to Chris. We'll deal with them before the next meeting. So thanks for that, Chris. That's really helpful. Good to see that progressing. Should we move on to our next item, which is the Integrated Care Development Plan and Highlight Report?
Okay, to continue, is that okay?
We got, I think, down on the agenda, we've got Ian to present.
Ian sounds struggling. Chair.
Got some sound quality issues, Ian.
Hello.
Try again, Ian.
Can you see me okay?
You're just a bit quiet, Ian.
You want me to come in? Be helpful.
Go on, Lydia.
Okay, so this development plan has been produced in response to the Integrated Care Development Matrix that was we all worked through earlier on in the year. So you're receiving two documents here. There is a development plan that's a really detailed one in Excel format which covers each of the domains. What you're receiving today is the summary document that sets out all the key actions and through the timescales, the different groups that will take those actions forward, and also a highlight report. And this highlight report was received at the last board meeting, and it's what we will intending to use going forward to keep Place Board up to speed with the different actions on those timescales. So as you'll see, it's like kind of like the first quarter, the first timescale that will be addressing, and it just gives you the actions that's taking place and where we are, an update for the board. So that's what the two documents are. Don't know that Ian's back in now, whether he wants to add to that.
Yeah, apologies. Can you hear me now, Sharon? Is
Yeah.
that better?
Yeah.
Apologies, folks. I was talking
Okay.
to hear you, but you can hear me. Yeah, so Lydia, I take it just given oversight on the work of the design team. So yeah, this is the quarter 1 update of the design framework. The design team and the engine remodel that will continue through September, Chair. So I think what we're doing here, there's nothing to highlight by exception in terms of us being off track on that quarter 1 report. Again, happy to take any comments or questions on it. Thank you.
Thank you, Ian and Lydia. Good teamwork there. Any questions or comments on the development plan that anybody wants to raise this morning? If I can't see your hand, please do feel free to shout out.
Can I just add one comment, Sharon?
Yes.
So in light of all the guidance that has recently come out, we will be revisiting this to make sure that it's up to speed and it incorporates anything further that we need to. So that's a piece of work that we'll be doing over the next month. So if there's any significant changes, we can bring that back to the next board.
Thanks, Lydia. And Ian, your sound was just coming out in and out a little bit. Will this be, are we going to update this quarterly? Did you say it'll come back to the Place Board on a quarterly basis in terms of our progress against it? It's quite a big plan, isn't it? And it'll keep us busy. But if we can do a quarterly update, that sounds helpful. Ben, did you want to come in?
Thanks, Sharon. Yeah, it's just on the population health management, and I guess just to make the point, I guess population health management is an approach as much as a tool, and I think what the ICP digital group are doing is the tools to support our population health management approach. But I guess it's then how we embed that approach through what we do as a partnership and what we're delivering, which I think needs broader than just the digital group involvement.
Can you, that's a really good point. Might be worth, Ben, just picking that up with Andy and also making sure we've got the connections with the prevention groups that obviously are being set up under the Health and Wellbeing Board. Yeah. People happy to agree that?
Yeah, Sean,
Michael, yeah.
Thank you. Yeah, just again, this is documents also going through our public board on Friday this week, and I've circulated the document to our executive team prior to that. So I don't expect any material comments, but if there are any, I'll feedback circulate to Chris.
Thank you. And I think, colleagues, as Lydia said, this is a live document. We do expect it to change and move. So if the delivery team can oversee that and then the Place Board can look at it on a quarterly basis, I think that's going to be important. It is quite a big piece of work, one that we're all committed to. So that regular review becomes really important. So on that basis, subject to the fact that there might be some tweaks and changes as we go on, as people get some more feedback, we're happy to agree that and get a report on next quarter. Yeah, brilliant. Thank you very much. If we can move on to our transformation updates, and these are the updates from the various working groups that support the Place Board and implement the Place Plan. I think the first update's from Susie about children and young people.
It is, thank you, Sharon. I can't see anybody, and I've not got my camera on. I think I've got quite a dodgy connection this morning, so apologies, colleagues, but hopefully you can hear me okay. Yeah. So in terms of the children and young people section of the Place Plan, the lead officer group's been re-established. That hadn't been meeting for a while, so we've got that back up and running now. We've reviewed the priorities and refreshed them, and all agree that they do remain the priorities. Bit of a mixed bag in terms of where we're at with the milestones. Some you know, we've got some red, amber and green. So we want to have a look at those in the next period and just make sure that the milestones are the right ones. I think there's a feeling from the lead officers that actually whilst the priorities are right, we're absolutely confident about those. We just want to revisit the milestones and make sure that we've got those in the right place and that they are the right ones. And we'll particularly want to review the priority milestones around the special educational needs and disabilities and the preparation for adulthood in light of when we get the local area send inspection report. So I think timing wise will be good within the next period, within the next quarter, to have a good look at those milestones and make sure that actually they reflect what we need them to reflect based on what we get through from the inspection. So it's a short update from me today, but progressing in terms of we've got the priorities agreed and we want to progress on with those. That's it, thank you.
Thank you, Susie. Any comments or feedback on the progress around children and young people? Probably just reiterate the point, Susie, that in terms of the outcome from our recent SEND inspection, we'll want to make sure that any key actions are firmly located in our multi-agency activity. So I know the group are aware of that, and we'll look to do that once we know the outcome of that inspection.
Yeah.
Okay.
Yeah. And it. Sorry, I don't know if you can hear me.
Yes, can hear you.
Sharon, but good timing actually, you know, for us to review, have a really good look at those milestones across the piece actually, but particularly for those, you know, we've got those two areas of our priorities in, you know, the children's transformation. So it makes absolute sense to align, you know, anything that's come through from the inspection findings, you know, to align those in there. So it is good timing to do that actually this next quarter.
Okay, we note that, Susie. We look forward to that further
Thank
update.
you.
And then mental health and neurodevelopment, Ian.
Yeah, thanks, Sharon. Can I just check you can hear me? Is that okay?
Yeah, can hear you then.
That's brilliant. So just a couple of things from me this morning, just to raise by exceptional leaves of doing place board. A bit like Susie was describing, we've revised all the priorities and we'll start reporting on those for next month in terms of new priorities and updates. But three things just to note coming out of the discussions more recently. The mental health and LD team have continued to meet throughout the pandemic process. Firstly, on neurodevelopmental, this will be a theme both in adults and children. We have now agreed in the Rotherham place to further invest in the adult pathway for adult neurodevelopmental care, which again supports our all-age discussions around neurodevelopmental care. So that's for both diagnostic and post-diagnostic. Linked to the comments that Susie just made, and working across the two themes, we will be able to now around children and people. Again, that we'll share with place board in months. Secondly, just to update the work around suicide prevention, which is one of our key priorities, Chair, in our 6 main priorities. We're looking to relaunch the Be the One campaign this Friday, so again, partners to know that, and also members of the public. So that's us again reinstating our commitment to suicide.
Ian, do you want to speak up a little bit because you've gone quiet again? Sorry.
That's right. I'm trying to shout in my own office here as well, so Chris will probably hear me.
That's
so, yeah,
better.
Is it? Okay. So we're trying to we relaunch our suicide prevention campaign this week, so that we can do accordingly. And then finally, our continued work on the IAPT pathways. I know Matt's on the call, working across RDASH and IESO, which are another partner in the system, just to try to manage demand in the Rotherham place. So again, we'll give further updates on that in future post boards. Apologies if that dropped out.
Thank you for bearing with us despite your technical issues, and for agreeing to shout. That was helpful, Ian. Thank you. Matt, do you want to come in?
Yeah, I apologise, Ian. I missed a couple of bits that you were saying there. Just couldn't quite hear. But I think Ian summed up things really nicely there. And obviously, lots of developments going on around the IAT work, and that particular piece of work is really kind of key for us, I guess, in terms of providing easy access for the community. But yeah, good joint at work.
Thanks, Matt. Thanks, Ian. And I think obviously it's, we've been extremely challenged, and people have kept meeting, have kept progressing things that we can within the plan whilst responding to the immediacy. And next quarter, we'll go back to actually the written updates against the plan, but pass on our thanks, please, to the teams that have been working hard to maintain the services and enable that some of the transformation that we've put in the plan to actually progress. So I think next quarter we'll see more detail about how that looks against the specific milestones. But thank you. I hand over to Michael around urgency and emergency care. And
thank you, Sharon. It's a very similar story actually to what we've heard from Susie and Ian, that we've started to get traction. We're meeting again. We've been through the priorities, updated and refreshed, and the milestones. We are, as I said, we are getting traction. There are quite a few agreed, progressing to plan, and there's some that aren't yet due. But just as a refresher, the key areas that we're focusing on are enhanced health in care homes, urgent response, prevention and discharge, and also the front door. And there's numerous projects that we're working collectively, and our leads are either Penny Fisher from the community or Claire Smith. And it definitely seems we're having some relatively quick wins. We've done a lot of work with our care home, Thorpe, which is in place. The contract runs until November, and I think that is currently out to market, as I understand it. So we'll be looking to renew that. But yeah, I think it's progressing as well as we could expect during the pandemic. It has been a distraction, as you say, Sharon, but I think we're doing what we can.
Yeah.
I think that's it. Take any questions.
Thanks, Michael. Any questions for Michael this morning? I think we probably do need to recognise as well that we've had stubbornly high rates of transmission for a prolonged period of time that has obviously meant a lot of focus on activity in the immediacy. But this is about now recognising the progress that we've made and actually making sure we stay on track in terms of the transformation challenge that we set ourselves. So good to know, Michael, that despite some of the challenges that it's still progressing, and we've got a number of things that have been achieved. And again, next quarter, we'll be able to see that more formally in the written highlight report.
Thank you.
Okay, thank you for the updates, and please pass on our thanks to frontline staff that are working under all of these and despite the pressures. Move on to our next item, which is social prescribing.
Thank you, Chair. This is an update on the Rotherham Work and Social Prescribing. As we know, our Rotherham Social Prescribing scheme has been running since 2012. I can't quite believe it's been 10 years next year, but the time's really flown. Our social prescribing scheme initially covered long-term conditions and mental health. Through long-term conditions, the GPs identified those patients most at risk of unplanned hospital admission and A&E attendance, and work with the social prescribers. The mental health scheme predominantly works with colleagues from RDASH, those individuals who are stable but actually could do with a social prescription. The assessment takes place. We also work with the primary care networks. As we know, a couple of years ago, the national scheme expanded social prescribing for primary care networks to be able to resource and support link workers, and their role is to work with a wider cohort of patients, trying to identify those patients that would benefit from a social prescription. So our long-term conditions, mental health and link worker scheme work closely together from a patient experience to ensure that actually patients get the best possible outcomes, no matter where they enter in that system. In terms of the more broader work and developments for social prescribing, our social prescribing scheme has been working with colleagues looking at the long COVID clinics. So social prescribing has been supporting the long COVID questionnaires for patients in anticipation of the setup of the formal TRFT long COVID clinic, and that involves detailed questions and analysis of where patients are to assess their needs in relation to long COVID. And we're anticipating that when, I think it's been set up now, the formal long COVID clinic in the hospital, there will be a social prescribing advisor linked to that to support those particular patients who have a non-medical need. More broader, as part of South Yorkshire and Bassett Law, we were successful as an ICS in securing some resources under green social prescribing. And green social prescribing is looking at so the outdoors and interventions which would benefit potentially individuals, which are sort of green and blue in relation to gardening, horticulture, water, and we've been working with the Sheffield and Rotherham Wildlife Trust to understand some of the existing activity in our region that fits green and blue, and how that can be developed and where the gaps are. There is a bit of money attached to that, a small grants to increase the provision of social prescriptions to targeted groups. The other piece of work that's going on in the background is the colleagues in the CCG are working with colleagues from public health to look at a pilot with the Department of Transport, looking at a small pot of funding to look to see if we can secure funding to support cycling and walking interventions, again linked to the link workers in the primary care networks. So if that bid is successful, we can bring further information back to the board. We've been working with RDASH to increase resources to frontline BCS organisations. As we know, mental health in the pandemic has clearly been exacerbated for many cohorts of individuals, and we've been able to have some additional money, the 64,000, which has enabled us to increase a number of frontline services for social prescribing, including counselling. More broadly, at an ICS level, we've been working with the Health Equalities Partnership as part of that programme to look at the uptake of social prescribing from a range of individuals. And one of the things that was identified within that was cultural competency for some colleagues, and we're working to develop a programme of ensuring that there's cultural competency awareness and training for particular colleagues in the system. We've also been doing some work in the background looking at BME and BAME volunteering and the social prescribing, because that was an area that was identified as underrepresentation in terms of BAME individuals coming forward in relation to volunteers and access to social prescribing. And then specifically in Rotherham, we've been working with colleagues in the CCG and with NHS Property Services. As the paper outlines, there was an empty shell of a building in Romarsh linked to the Romarsh Customer Services Centre, and that has brought some investment into Rotherham. That building has been fully equipped in terms of, it was bare brick, as the paper says, and that's now essentially a sort of a community centre, but not more broadly, but specifically linked to BCS organisations who are providing social prescriptions, and how they can create a community hub in that area by increasing activity where social prescriptions are concerned. And the paper lists the organisations who are taking space in there provide more support to individuals and particular types of services. So there's a lot happening, Chair, in terms of social prescribing. Although we're branding it, and I understand the context of social prescribing, lots of activity takes place within the VCS without any sort of formal social prescribing. Our scheme in Rotherham is unique in that it is one of the only ones that actually supports the actual provision of the prescriptions. It resources frontline VCS organisations for them to be able to provide those prescriptions, which is really important in relation to sustainability of those frontline VCS organisations. Lots happens which is little or no cost, but equally speaking, the sector needs the funding to be able to provide some of those services. Happy to take questions or comments.
Thank you, Shafiq. That's really helpful and good to see. Can't believe either it's 10 years. That's amazing. Questions, comments to Shafiq on social prescribing? Just a question, Shafiq. I'm really sad to see that some of the volunteers have had some difficult phone calls and some abuse. Have we got regarding some of the in relation to the setup of the long COVID clinic? Have we got a date now when that goes operational?
We have, and I've forgotten it, Sharon. I was told that I think actually this paper was written. So my understanding, it is actually operational now.
Any colleagues on the line? Cock, can you come in?
Yeah. Thanks, Sharon. Shafiq, thank you for that update. Just wondering about this green prescribing, Shafiq. Could there be more communications, especially in the practices? I haven't seen anything in my practice. I've just walked around. So I just wondered whether there was anything which our comms can help us with, or yourselves, your organization, just to get more people to be aware of it. We could have plenty of people, I think, who could make good use of this within our practice. Thanks.
Definitely, Dr. Mutu. The scheme has actually been operating in the sense that the Sheffield and Rotherham Wildlife Trust have done some mapping, but it's about to go live in terms of the funding pot. So we'll be working closely with the link workers to ensure that they're informing the types of green activities that need to increase. And also, I think it's a good point. I'll make sure that within the newsletter for the link workers that we update you on the green social prescribing programme.
Thanks, Shafiq. That would be really helpful. And
Chair, just to let you know, the long COVID pathway went live last week.
Brilliant.
Okay, thank you.
Matt, Gordon, can if it's gone live last week, might just be helpful just to review the comms and just make sure that we've updated the relevant sites and social media so people are aware about how to access.
There is a comms plan, Sharon, and we have started doing that. So yeah, we will be doing it.
Brilliant. Thank you very much. Anything else this morning on social prescribing? Good to see that's continuing to develop. Should we move on to the integrated care guidance then, which has just been issued? I think this is you, Chris.
Yeah, just wait a second while everyone accesses it. So we've been promising guidance for a short while now, and it's all come at once. So Wendy's very kindly, rather than put you a whole load of files, we've got like a library that's been attached with the papers. There are 13 documents that were published during August, and I'll just do a very, very high level jog through, if that's okay. I am assuming that people have access to them and have read them. So the first one was building strong integrated care systems everywhere. This is, again, nothing in there that, no surprises in there. It's as we would expect, and as has been sort of mooted by the national team for a while now. We've got the HR framework for developing integrated care boards, which talks about appointing a designate chair, a designate chief executive. Also got a designate chief nurse, medical director as well, and director of finance. So the posts, the mandated posts are starting to appear. Also the requirement for non-executives, minimum of 2. The Then we've got the due diligence and transfer to an ICS. So that's work for people like me, accountable officers of clinical commissioning groups, to make sure that we're absolutely have a smooth transition from clinical commissioning groups to integrated care board. Integrated care boards is the language we're using. That'll, again, subject to legislation, that's planned for 1st of April. Again, the due diligence checklist. These are huge documents. Again, not something the partnership probably needs to get involved with. It's more for the CCG to manage, but it's just there so you know it exists. And the integrated care board model constitution, again, there's 2 documents detailing that. Interestingly, the integrated care board, or what we currently call ICS, will have a constitution, and I guess all members will need to be signed up to that. There's interim guidance on the functions and governance of an integrated care board. Again, so that clarifies what we'd expect, but primarily it's the functions associated with clinical commissioning groups, some regulatory functions associated with NHS England, and also potentially some delegation of specialised services and primary care services from NHS England as well. I will keep going. So the 9th document is the NHS direct commissioning functions pre-delegation framework. Again, that's functions from NHS England and NHS Improvement that could go to integrated care boards. Readiness to operate statement checklist. Again, another checklist to make sure we're ready for the 1st of April. And the document 12 is slightly different. So it talks about provider collaboratives. Again, in Rotherham, we've been developing a provider collaborative for some time. I recognise we've got some more way to go on that journey. So the provider collaborative document, again, there's no surprises in there. There's a few case studies in there. There's nothing I don't think in Rotherham particularly not doing. However, it's a good reference document for us in our development of our provider alliance. And then the 13th document is a ICS design framework, which this is a document I think as a partnership we will need to go into some detail on as we go forward. So if we just flag that one up as well, that people are aware of that. That was one that came out in June there, which we were aware of. If members find it useful, what we'll do, Wendy, if it's okay, we'll continue to populate this log and keep it as a live log so we lose track of the documents. There's so many documents at the moment, you can lose track. So what we'll do is we'll keep it as a library. But I'm not going to go through them all slavishly. We may pick and choose odd ones to go through at future meetings, Chair, as appropriate.
Thanks, Chris, and well done to you and Wendy for bringing all that together in one place. That is extremely helpful, seeing all that together. And I think probably the most important ones for us that we'll probably want to bring back through relate to the design framework, and notwithstanding the fact that a lot of the guidance will be implemented by CCG colleagues on an operational basis, but understanding and participating in the ICS design will be probably the most important action for the place board over the next few months. Any comments or questions? People got enough guidance?
And it's all subject to legislation. We must keep saying that.
Yeah, but good to have it and good to be working on it in preparation. Okay, noted. Thank you for that, Chris. Will keep us busy for quite a while, I think. So just moving on.
Sharon, I was just going to ask if Chris has got any clarity on the time frame for the legislation. Are we still expecting that to go through before Christmas? Or
my current understanding, Ben, is that the committee stage will be commenced through the autumn, and final assent February time is the latest timescales I've got.
Thanks.
I'm sure we'll be kept up to date, Ben, on a regular basis as that moves through. I expect further guidance will be provided. Okay, thanks for that, Chris. Are we happy to agree the draft minutes from the Public Place Board that happened on the 7th of July? Any issues anyone wants to raise from that? We'll take them as accepted, thank you. And then any communications to partners this morning that we'd want to share?
Chair, just picking up on the long COVID, I'll make sure that there's information goes to partners to make sure that people are aware of the long COVID pathway and what people should do if they think they've got long COVID.
Ben, did you want to come in?
No.
Erroneous wave of the arm. I think the other thing is that we continue to encourage everyone that hasn't yet accessed their vaccinations to do so. So our work collectively as partners in terms of the vaccination programme continues to be really important, and also to reinforce the national guidance around safe working, around masks and safe distancing. So, some key messages that we'd all want to make sure that we get out to the communities we serve, given particularly that our infection rates in the borough remain high. So I think we need to continue collectively to do all we can to keep everybody as safe as we possibly can. Michael?
Yeah, thanks, Shannon. Just wanted to endorse what you just said. Absolutely, it's essential. But currently in the hospital with 75 positive patients, it's been very challenging recently, particularly around flow. So I think it's essential we continue doing as we are. So thank you for that.
Thanks, Michael. I think it is really important, and I know that our comms colleagues are working collectively, but the more that we can get those messages out around people actually accessing the vaccine and then continuing to undertake the behaviours that reduce the risk of transmission remain as important as they ever were as we go into the autumn period. So if we can continue to do that collectively, that'll be really, really helpful and really important in terms of reducing that community transmission as much as we possibly can. Any risks or items for escalation today that anybody wishes to raise? No? Okay. And then we've got our future agenda items, which will be our development plan and continuing to monitor our progress. And then we've got the review of place-wide IT services that we're expecting our next meeting in October. And then we meet again on the 6th of October, and I've got regular meetings now planned in on a monthly basis as we start to return to previous ways of working. Anything else anyone would wish to raise today? No? Okay, thank you, colleagues, and I look forward to seeing you in October.
Thanks, everyone.